Welcome back to the Healthy Community. I'm Dr. Dan with Dr. Pascal. So today we want to talk about an interesting, maybe some information that we have been looking at, and that is grip strength, but how that basically lets us know how your overall body is, how it's healing and functioning.
Right. I think most people would associate grip strength with just overall muscle mass, strength, a strong male or a strong female, but they wouldn't necessarily put the link together, which we didn't, or I didn't until I read this info, about grip strength being a predictor of your overall health status and mortality. Right? So, like some of the articles that we were looking at, we're discussing things like grip strength being a better predictor of heart disease than systolic blood pressure.
Right.
Which is kind of crazy, right? Blows your mind, right?
So what they're saying here, just to clear that up, is it's not that your lack of grip strength will give you disease, right? It's a predictor of how overall you're doing. And I think what they're kind of linking together is if you have a good grip strength, then that is also kind of letting us know that you're strong, you have independence, your body is doing what it should be doing, which again gives us an idea of how your heart, lungs, and everything else is functioning.
Right. So basically, if someone's starting to develop disease, and you're going down the path of heart disease, cancer, or these other problems that we start to see as someone's health declines, what's going to happen oftentimes is you're going to lose neurological function, you're going to lose muscle mass and maybe bone density, and so consequently your grip strength is going to go down further and further. And so you can use that grip strength to measure, okay, where am I guess, proportionately to other healthy individuals in my age class as well, right? So, there's different numbers here. We won't start listing out all of them, but for, adults 60 plus, a very good number, a cutoff that they'd want to see you above. Okay, so for 60 plus above, for females, we'd want to see you above 18 kilograms and males above 28. So 19 plus, 29 plus would be a good indicator of health status, kind of like that baseline that we want you above. Because what they were saying in this systematic literature review, meaning when they reviewed all the literature on health and grip strength, that if you're below those values, you're going to have a hard time, picking up a 20-pound object. And we know if you can't pick up those objects, it means that you're going to have a harder time with independence. Right? And so independence then leads to assisted living, falls, and hip fractures and so on and so forth, which then leads you to higher all-cause mortality. And that's where they can really start linking grip strength as a predictor of all-cause mortality. Not because I have grip strength, I'm going to have a heart attack. Right? Just to be perfectly clear on that. But a cool little useful test. Amongst all these other tests that we take on people, we should be measuring grip strength because it is a cool indicator of how you're doing overall.
Now, for some patients that, let's say, have been here for a long time and you're like, hey, I've never had my grip strength tested by you guys. Yeah, you're right, because we just started doing this, and probably give or take about a year ago, where we wanted to kind of really start to understand how else is the patient doing, objectively, like how are they doing on the inside without just kind of like, it's not just a pain factor, but it's how are they functioning. So we take grip strength, heart rate variability, their heart rate, and their blood oxygen level. So those are all things that could dramatically change as the body's getting healthier and healthier.
Yes, absolutely. And I think that goes back to, I think the perception of chiropractic pain, doc, my back hurts. When someone comes in to see us, almost always at first, it's because they have a pain condition or they have a problem that they want addressed. And we take care of the pain, but then oftentimes people don't understand that you're still improving, and the status of your health will continue to improve as you continue to get adjusted, even once the pain is gone. Right? And I think we used to explain this to people when we would do workshops, that health is not just merely the absence of pain, right, or the absence of disease, but it's really being able to function at an optimal health status. And so we wanted to show people that, yes, even though you don't feel any changes, your body is functioning better. Right? Because that's a hard concept. That's a hard concept to understand. It's like, I don't feel any different. But as a matter of fact, you can measure these small things that can show you that systematically, neurologically, you're actually doing significantly better, and your risk of all-cause mortality is going down.
And we've seen this with many patients where we've retested the grip strength pre and post, meaning that we've done a grip strength test, we've adjusted them, and done the grip strength test right after. And for a lot of people, it goes up by 20% or more.
Crazy.
So in that very short time, there was no different workout that was done, there was no stretches, there was nothing else other than that adjustment that increased that body's ability to recruit, direct, and basically do that, grip strength test just by the difference of that adjustment.
And that's what my favorite thing actually is, to do that, especially with athletes. Right? And especially if they're athletes that have been struggling with any type of problems, shoulder, neck, so on and so forth, and all you do is adjust their neck and you do that pre-post test. When they see that, because they get it, like, I haven't done anything else and my grip strength just went up by 20%. It's like, woo, the wheels are turning. Now they're getting that. This has way more to do with neurology than pain and function, right?
And could you imagine if that has that effect on a grip strength, like basically a muscle test?
Yeah.
What else is that adjustment doing on the inside? How is that affecting your heart, your lungs, your immune system, your ability to heal and adapt on a daily basis? And that's what is so cool about chiropractic, and it still amazes me every day, is that impact on the body like that.
The nervous system. Yeah, absolutely. So the main reason that we started measuring grip strength, again, is not to show you how strong you are, but it's to show those neurological and systematic improvements over time. And yes, sometimes we do it pre, post, and adjustment, but most of the time we do it before and after rounds of corrective care. Because we want to show people that as we're fixing the spine, as we're actually changing the structure of your spine, great, not only does your spine look better on x-ray, so you can model your spine out, but now functionally you're doing better. So we're showing you that structure equals better function, equals better healing and better health. And so that's where I've been really excited by measuring this stuff, is seeing almost consistently every person that goes through a round of corrective care has better grip strength, better heart rate variability, often a lower heart rate, and better pulse oxygenation. And this has been largely during a pandemic when gyms have been shut down, which is the crazy part too, right? So like, you can't argue that these people are getting, good training elsewhere outside, because most people aren't doing that much when it comes to physical exercise. So it's pretty cool stuff to test. So if you haven't been tested, because you've been here for a couple of years now, ask us, we'll gladly test you. And if not, if you want to do this and test this at home because it's something that you want to monitor, buy a dynamometer. You go on Amazon, they can range from $50 to I think about $200. It's simply something that you can hold in your hand, squeeze, and it tells you, how strong you are proportionally as well to people in your age class.
So hopefully that could maybe help you understand a little bit more about what we do and why we do it, but also how, like we talked about, how your grip strength could affect your overall basically, a predictor of your health and wellness. So again, if there's any questions or anything else that kind of comes up, let us know. Give us a call here, 204-474-1159, or if this information could be beneficial for a friend or family member, please pass this on. Our goal is just to help as many people as we possibly can understand health and wellness a little bit better. So have a great rest of your healthy commute.